Myself, Dr. Karthik, Associate Professor, the Department of Oral Medicine and Radiology, Vinaya Mission Sankaracharya Dental College, Salem, Tamil Nadu. My topic is on anomalies of tooth. Coming to the classification of the anomalies of tooth, in their number, it is classified as anodontia, means complete absence of teeth or total lack of tooth development. Cases of anodontia are seen in ectodermal dysplasia. Hypodontia means lack of development of one or more teeth. They are seen in Down syndrome, Crouzon syndrome, Garland syndrome, and Hurler syndrome. Oligodontia means lack of development of at least 6 or more teeth. Hyperdontia, the term, refers to development of increased number of teeth. Hyperdontia can be seen in Down syndrome, Apert syndrome, and Ehlers-Danlos syndrome. This case reported to our department with a small conical teeth in between the two permanent maxillary central incisors. This case reported with the fracture of the maxillary right central incisors. But when we take an intraoral periapical radiograph, it revealed two more inverted small conical teeth in relation to the maxillary central incisors. These small conical inverted impacted teeth within the anterior portion of the alveolar bone is referred to as mesiodens. This patient presented with the spacing between the maxillary central incisors. On intraoral periapical radiograph, he had an impacted canine and also a small conical supernumerary teeth. This intraoral periapical radiograph revealed a small conical inverted impacted mesiodens with a large well-defined radiolucency surrounding the crown of inverted impacted mesiodens. This is nothing but a dentigerous cyst that usually occurs around impacted tooth. Sometimes we see a mesiodens even extending into the nasal cavity. The wide panoramic CBCT reveal an inverted mesiodens that is even extending into the nasal cavity. So the palatally mucoperiosteal flap was elevated and the inverted impacted mesiodens was removed. It is also called an intranasal mesiodens. Mesiodens is the most common supernumerary teeth that usually occurs between the two maxillary central incisors. Can be erupted or palatally or buccally placed or even rotated or impacted within the maxillary anterior alveolar bone. Rarely, these mesiodens can extend into the nasal cavity, causing nasal stuffiness. The main clinical significance is that it can lead to external root resorption of the adjacent tooth or development of dentigerous cyst. Coming to this case, there is a talon-shaped structure on the palatal aspect of the right and left maxillary central incisors. Since it resembles an eagle's talon, it is called a talon cusp. In this picture, we see a talon-shaped cusp on the labial aspect of left maxillary central incisor. The frequency of talon cusp is that it most commonly occurs the permanent maxillary lateral incisor, about 55%. The least commonly affected by talon cusp or maxillary canine, about 4%. This picture reveals a fusion of the crown of the central and lateral incisor. This is referred to as fusion of the teeth. Such fusion of teeth creates an unaesthetic appearance and needs to be treated. Fusion is defined as the union of two adjacent teeth by dentin. Fusion is a single enlarged tooth or double tooth, also called conated tooth, can affect both the primary and permanent dentition. More commonly reported in the anterior maxillary regions in the maxilla and mandible. Usually, such fusion of the tooth can have two separate root canals, but not in all cases. Sometimes can have one enlarged root with a single canal. Here we see the fusion of the crown with the maxillary mandibular third molar. Concrescence is nothing but fusion that occurs between two adjacent tooth by cementum only. Commonly occurs in the third molar region along with supernumerary teeth. Etiology is always controversial. Some suggest that space restriction during the development of the tooth or any local trauma, excessive occlusal force or local infection after development of a tooth plays an important role in concrescence. There are two types of concrescence, namely true concrescence and acquired concrescence. True concrescence is that the concrescence occurs before root formation. Acquired concrescence is that the concrescence occurs after root formation. This picture reveals a small globular mass of enamel at the bifurcation region of the root of the mandibular molars. This is referred to as an enamel pearl or enameloma or enamel drop. They are nothing but ectopic enamel at unusual locations. They are common at the bifurcation region of the maxillary or mandibular molars, occurs commonly near the cemento-enamel junction. Clinically, they appear as spherical globular masses near the cemento-enamel junction or at the bifurcation of the roots of the molars. What is the main clinical significance of such enamel pearls? The exophytic nature of the globular mass of enamel located near the cemento-enamel junction can favor more plaque formation, and they are difficult to clean or maintain, hence resulting in rapid loss of periodontal attachment. This picture reveals a sharp acute bend or curvature in the root tip. This is referred to as a concrescent dilaceration. Dilaceration is a developmental anomaly in which there is abrupt change in the axial inclination between the crown and root of the tooth. The most common cause is any trauma to the developing tooth. The clinical significance is that dilacerations affect maxillary anterior teeth, can lead to failure of eruption of the teeth. Dilacerated tooth can favor the formation of periapical lesions. Their abrupt sudden angulation can result in transmission of excess occlusal force during occlusion. This case reported with discoloration of the tooth. On proper visualization, there was complete areas of malformed enamel all over the crown of the teeth, and it more or less looking like a brownish in color. On taking an orthopantomograph, the contrast between the enamel and dentin is more or less the same. This condition is referred to as amelogenesis imperfecta. Amelogenesis imperfecta is also called hereditary brown opalescent enamel. It is a hereditary condition in which there is developmental malformation resulting in hypoplastic enamel. Patient usually gives a history of consanguineous marriage. They are more common in the permanent dentition. All the permanent teeth were affected. There are three types of amelogenesis imperfecta, namely hypoplastic type, where we can see uniform discrete pitting of the enamel. Hypocalcified type. In this type, the tooth chips away even by normal masticatory forces due to the weakened enamel. Hypomaturation, uniform malformation in the crown structure. This case also presented with similar brownish discoloration, but the enamel contrast remains intact in the orthopantomograph. This is a hereditary condition affecting the dentin called dentinogenesis imperfecta. This case reported with discoloration of the tooth. On close examination, there was pink in color. There was a history of trauma. On intraoral periapical radiograph, you can see a ovoid radiolucency within the apical portion of the root of the maxillary central incisor. It is nothing but internal resorption resulting in pink tooth of mammary. There are two types of internal resorption: inflammatory resorption and replacement resorption. Inflammatory resorptions are usually caused by trauma. The resorbed areas of the dentin is replaced by a granulation tissue. Cervical portions are commonly affected. It usually has a well-defined root canal outline in radiographs. Replacement resorption, the resorbed areas are replaced by bone or cementum-like bone. The intraoral periapical radiographs reveal partially obturated canals with an ill-defined root canal outline. So this case presented with the additional tooth on the palatal aspect near the second premolar and first molar region. Similarly, in mandible, we see an additional small tooth-like structure on the buccal aspect of mandibular first and second molar. In this, we see an additional tooth-like structure on the lingual aspect of mandibular first and second molar. This is nothing but a paramolar. A paramolar is a posterior supernumerary teeth situated lingually or buccally in relation to a molar tooth. There are other types of teeth such as natal teeth and neonatal teeth. Natal teeth are those teeth which are erupted mandibular central incisors seen in the newborns at birth. The clinical significance is that these natal teeth present at the birth can induce ulcers on the ventral surface of the tongue, hence called Ragafeed disease or Ragafeed ulcers. Pain ensures and the infant may pose difficulty during breastfeeding. The neonatal teeth are those teeth that arise during the first 30 days of life. This case presented with a small tooth-like structure distal to the last molar, the maxillary molar. Such, when I had taken a radiograph, it also revealed a small tooth-like structure distal to the maxillary third molar region. This is referred to as distomolar. The distomolars are also called fourth molar or retromolars. Due to their posterior location with respect to third molars, can be heteromorphic, presence of a conical crown and rudimentary root. There are also eumorphic distomolars which resemble the shape of the premolar or molar with funnel-shaped crown. Moon's molar, also called Fournier molar. These are mulberry-shaped molars with multiple rudimentary cusp-like projection on the occlusal surface of the permanent first molars. It was described by Fournier and Moon, hence called Moon's molar or Fournier molars. They are seen on the occlusal surface of the maxillary or mandibular molars, usually seen in patients affected by congenital syphilis. The main cause is supposed to be enamel hypoplasia secondary to congenital syphilis. The clinical significance of Moon's molar is that it can manifest late in childhood. It is a marker for congenital syphilis. Here, in this case, we see a notching of the incisors. It's a condition called Hutchinson's teeth or Hutchinson's incisor. They are shovel-shaped notching seen in the maxillary or mandibular incisor, seen in congenital syphilis due to enamel hypoplasia or lack of enamel formation during the development of the child. The middle lobe of the tooth is usually affected than the three lobes of the mamelon due to enamel hypoplasia, named after Sir Jonathan Hutchinson, an English pathologist who discovered it in 1858. They are smaller than the actual size of the incisor tooth and they are usually tapered. Dental fluorosis, commonly seen in the fluoride belt regions among people of Salem, Dharmaburi, Hosur, Krishnagiri districts. It results in an unaesthetic, chalky white appearance on the surface of the tooth and also results in pitting or mottling of the enamel. It is usually caused by ingestion of fluoridated well water containing greater than 1 part per million fluoride. Chalky white intrinsic stains with pitting or mottling of enamel or intrinsic brownish bands, these are the characteristic features of dental fluorosis. Such teeth usually fluoresce under UV light. Thank you.